I'm Barbara Flynn Curry. I'm currently the president of IWILTA Training Academy, and it is my distinct pleasure to welcome you all tonight to our annual Dawn Clark Netsch Policy Forum. Our topic is Public Health Disparities, COVID-19, and beyond. Before we get started, note that today's event has closed captioning. You can find it at the bottom of your Zoom toolbar, and you can turn it on and you can turn it off. Each year we sponsor this forum in honor of Dawn, a true blue trailblazer in Illinois politics. She was a state senator, Illinois comptroller, Democratic candidate for governor, and one of the first women to serve as a teacher in a United States law school. She worked for women's rights, civil rights, well, that's to say human rights. She was one of our organization's founding mothers. Before I turn it over to tonight's moderator, a shout out to our IWILTA Training Academy delegate class of 2021. They've recently graduated, and a shout out to our board members and all the alumni who are with us. We're glad to see so many elected officials with us this evening. Some of our friends from the General Assembly are here, Representative Robin Gable, Representative Fran Hurley, and Representative Denise Stoneback. Thank you so very much. It's so important for policymakers and community leaders to listen to the experts when it comes to addressing public health issues. We're grateful all of you are here with your ears open. We hope you'll learn something to take back to your jobs, your communities, your legislators. And finally, a grateful welcome to the public experts who've joined us tonight. Kathy Chan, Director of Policy at Cook County Health, Dr. Ngozi Ezike, the Director of the Illinois Department of Public Health, and Dr. Vidya Sundareshan, a professor and the Chief of Infectious Disease at SIU School of Medicine. With that, join me in welcoming tonight's moderator, IWILTA Training Academy board member and treasurer, and the chair of the Illinois House Committee on Healthcare Availability and Access, State Representative LaToya Greenwood.
Thank you. Thank you, Barbara. I have been looking forward to moderating the conversation this evening focused on public health disparities, the impacts of COVID-19 and beyond. I am honored to begin to introduce our dynamic panel this evening. And after the introduction, they will be provided a moment for brief remarks. First, we'll start with Kathy Chan. Kathy Chan is the Director of Policy for Cook County Health, where she provides leadership on policy issues that impact CCH and its patients, as well as with special initiatives that address social determinants. We are so happy to have you as a panelist, Kathy.
Thank you so much, Representative, and thank you, Barbara, and thank you to IWILTA for the opportunity to participate this evening. I'm really humbled and honored to be part of today's discussion. As Representative Greenwood mentioned, I serve as Director of Policy for Cook County Health. And most people, when they hear the words Cook County Health, think immediately of Stroger Hospital, which is our flagship location. But we also serve the residents of Cook County through a number of other facilities, including Provident Hospital on the south side of Chicago. We operate a number of regional outpatient centers and community health centers throughout Chicago and suburban Cook County. We also provide care at the Core Center for individuals living with HIV, correctional health at the Cook County Jail, as well as the Juvenile Temporary Detention Center. We run the Cook County Department of Public Health and provide public health services for most of suburban Cook County. And last but not least, we also run County Care, which is the only provider-led public Medicaid health plan in Illinois. I'm really proud to work for a system that has a 2-century history of providing care to everybody, regardless of background or immigration status, insurance status, or ability to pay. And we live in a state where we're fortunate enough to have Medicaid expansion. And this has led to significant opportunities in closing the coverage gap for Cook County residents who previously did not have access to Medicaid or other affordable forms of insurance. Our health system continues to provide really high volumes of care to the uninsured. In our upcoming 2022 fiscal year, we project that close to 35% of our total patient volume is going to be from individuals who remain uninsured and remain uninsurable. And tonight's discussion is particularly timely, and we knew this before COVID, but as we continue to manage our way through the pandemic, access to healthcare that's culturally responsive, accessible, and trusted is really imperative to health. From my perspective, we really can't limit the coverage and payment of healthcare only to services provided by a physician or a nurse, or services that take place within a hospital or the four walls of a clinic. We really need to think broadly about the issues that contribute to good health, like access to affordable and healthy food, safe and stable housing, as well as economic security, and probably other issues that many of you think of as well when you think of what contributes to health. And this is going to require all of us to do and think about things a little bit differently. But if there's anything that we've learned during and throughout COVID, is that we really need to think big, as well as listen to and partner with the community. So again, thank you again for the opportunity to participate tonight. And I really look forward to the conversation.
Thank you. Our next panelist, I mean, she needs no introduction. I think we all know her from all over the state. Dr. Ngozi Ezike. Dr. Ezike is the director of the Illinois Department of Public Health, the first Black woman appointed to lead the 143-year-old agency. And during her tenure, she has been just at the forefront of this whole COVID-19 issue in our state of Illinois. And so, Dr. Ezike, would you like to offer brief remarks at this time?
Yes, thank you so much, and good evening to everyone. For almost 2 years now, we've focused on eliminating the virus in Illinois and tried to save as many lives as possible. And during that time, even with the introduction of newer and faster testing methods, the introduction of vaccine options and antibody therapies, we have still seen a disproportionate number of cases and fatalities within communities of color, also within other hard to reach communities and vulnerable populations. From data collected and analyzed, we learned that COVID was not affecting everyone in the same way. It was not a one size fits all, and that social determinants of health contributed heavily to these disproportionate cases and fatalities. You know, to address this, we took a collected impact approach, focusing on the inequities exacerbated by COVID in communities across the state. We convened a health equity task force. They were on every single one of our calls. They were made up of community partners, faith-based partners, advocacy groups, local, state, and federal partners. And the goals were to, 1, identify key populations and their specific issues. 2, to develop recommendations to address the equity issues. 3, share the information across the other work groups in the COVID response and support the overall goal of the task force to stop the spread of coronavirus in communities of color and vulnerable populations. And it really helped us understand better and how to address better the social determinants of health that contribute to these disproportionate fatalities. This task force employed a 5-pronged strategy of service, identification, amplification, provision, and then of course, follow-up to emphasize the commitments to communities and marginalized populations. And many of the recommendations developed became embedded in overall policies and strategies going forward for the entire statewide response. Some of those include gaining community input on where testing deserts are, and having community-based organizations partner with IDPH to host our vaccination clinics, our testing clinics. Early adoption of equity vaccination pods, which caught the interest of FEMA, our federal emergency management agency, are now the model that we're using for having school-based clinics. Rural and migrant engagement, has provided language to improve safety standards for employers and simplified and translated documents and videos for our non-English speaking workers. The task force also provided input on communication strategies to try to dispel myths and disinformation. We spearheaded masking and social distancing campaigns to include young people. We hired young social media influencers to help us create appropriate content to reach people of all ages and stages. We conducted listening conversations with all these different groups to make sure that no one was left out of the discussions: homeless populations, immigrant populations, LGBTQ populations, differently abled populations, rural individuals. This helped IDPH create messaging and identify the right messengers who would go on to share that important information within the communities. One program aimed at dispelling myths and disinformation and leveraging the key influencers and messengers recruited Black and minority barbershop and beauty shop employees to participate in the federally funded Shots at the Shop campaign, which encouraged owners to post and distribute COVID information and host vaccine clinics at their salons. The recommendations advanced by the Health Equity Task Force continue to drive the discussion around disparities, inequity, and the impact of social determinants of health as it relates not only to COVID, but many other challenges that we continue to face. The development and distribution of culturally appropriate, linguistically appropriate information, adequately trained personnel, equitable access to the personal protective equipment, housing and food insecurity resources, access to social services, and a violence prevention resource list are just a few of the tactics and the strategies being advanced for consideration at the legislative and executive levels. So even as we work all together to put COVID behind us, we fully recognize that these disparities are not tied exclusively to the eradication of the coronavirus. Tackling health disparities in our communities is work that reaches beyond the boundaries of just public health, and it impacts all of our disciplines and all of our areas of responsibility. In fact, it is a collective responsibility. And so as members of the collective, we are both beneficiaries and looking forward to making sure that we ensure the success by working together, not just on COVID, but many other issues and challenges that we can take on in a better method going forward. Thank you.
Thank you. And next we have on our panel, Dr. Vidya Sundareshan. Dr. Sundareshan is a professor and the chief infectious disease at SIU School of Medicine, as well as program director for the Infectious Diseases Fellowship Program. Dr. Sundareshan.
Thank you so much, Representative Greenwood. Thank you, President Curry, and thank you, IWIL Training Academy, for this opportunity to be on this esteemed panel. Some of my public health idols are on this panel, and I'm really excited to be here today. So thank you. I am actually going to bring a perspective of a medical advisor of a not so small and not so big county, Sangamon County, Springfield, Illinois. As a medical advisor, the first thing that actually struck me was the lack of public health infrastructure. I clearly remember in the beginning of the pandemic, we expected the first surge to come around April 15th here in Springfield. It was a week behind when it's expected in Chicago. So there is really a difference between what's happening in the north side, on the south side of Illinois. So there's some kind of customization and some kind of tweaking in the policies or decision-making that needs to be done. We did not have local data We had data from the national level, we had state data, but we did not have local data. So it was important to start collecting information which is relevant to what's going on here. So that was the second thing. Data collecting systems to establish those. Communication. We do have multiple organizations here in the community, about 4 or 5, and we wanted to make sure that the communication and the messaging is completely aligned. So that was another collaborative opportunity between all the organizations coming together as public health officials, healthcare personnel, business groups, statisticians, researchers, scientists. We were able to come together and come up with response strategies for the pandemic at a local level. So I really appreciate the fact that we were given a seat on the table when these decisions were being made, decisions that Dr. Ezike was talking about. So we were given a seat on the table, which was very helpful to gain perspective, and then also the freedom to incorporate the variations for as it would be relevant at a local level. So I think that really helped us understand how, what is a policy written by someone at CDC may not really apply to what we are doing at the local level. So I think moving forward, as an institution, we were able to contribute to the local health department as a medical school. We were able to offer advisory role. We were able to be there in a consulting role. We were able to help out with resources in the community where there was testing required. The school was able to help out with offering testing in the community where the testing dry areas, we were able to incorporate that service. Homeless populations, you want to make sure that there are no outbreaks. So the school was able to help out in situations there. Research to collect data at the local level. We were able to provide a statistician who in fact still continues to verify the data. The state data is about a week behind. So we are able to have that local data on a daily basis with the statistician that's available here. So I think those were some of the things that, were really good for us to be able to have those resources and utilize those as it applies to us at the local level. And moving forward, we just hope that the collaboration continues and the momentum that we have gained for reconstruction and then also dealing with any pandemic. We just hope that the momentum in this work continues. Thank you.
Thank you so much. And before we get started with our questions, I just wanted to thank all of you for the work that you have done to continue to move us forward as a state during this pandemic. And to also say, welcome to all of our attendees this evening. We are very excited to have you join us. So we'll hop right into our questions. COVID-19 has disrupted all of our lives in the past 2 years, but we know its effects have disproportionately borne by low-income communities of color, and healthcare workers. What obstacles and/or hesitancies are you seeing towards vaccinations at this time? And I know, Dr. Ezike, you recently testified before Congress on this very issue. So if you could start us off, please.
I'd be happy to. Thank you. So as we've said, one size does not fit all, and even the reasons for hesitancy have been very different for different communities and maybe even different individuals within that community. We've seen misinformation around young women and their ability to be pregnant or maintain pregnancies associated with vaccination. We've seen people who are maybe undocumented who think that getting that vaccination will somehow adversely affect their status or be reported to immigration authorities. We've seen people from other populations of color. Black people have often cited what happened with the public health teams and the Tuskegee events as reasons to be distrustful of public health. And, you know, so the list is extensive for the different ideas, prevailing ideas that have informed people's decisions to avoid vaccination. And so without having a very aggressive way to stay on top of those, we're often fighting a very uphill battle where the message has gone out broadly to many people about something that's not true, and trying to pull that back becomes like trying to put the genie back in the bottle.
And any other comments?
I'll add, I mean, ditto to everything that Dr. Ezike said. I think really what is important now is pivoting to hyper-local strategies and meeting people where they're at. So efforts that began at the very start of the vaccination campaign with the mass vaccination sites, you know, we've pivoted away from that and gone more to looking at how do we do very hyper-local events, looking at the data where there are rates of under immunization for certain populations. And unfortunately, again, this goes back to a lot of communities of color, communities that are disproportionately African-American or Latinx, meeting people where they're at, partnering with employers that might have a lot of workforce. And we have to recognize that many people don't have access to paid sick leave right now still, and going to those employer sites and making it convenient and making it accessible and trying to dispel many of those myths about, you know, that Dr. Ezike mentioned, as well as in-home vaccination efforts. So really thinking about where are all of those opportunities to meet people where they're at, and partnering with community organizations, I think has helped start to chip away at some of that hesitation and start to get the positive messages out. We still have a ways to go, but I think that is part of where the strategy really is right now.
And I would just like to add, thank you for those comments, excellent comments. Replacing vaccine hesitancy with vaccine confidence is a good strategy. So CDC has been encouraging that. Time, it takes a lot of time. With people that I see in clinics, it takes a lot of time to explain to them the science people still consider as new. The mRNA platform, mRNA technology, they still think it's new. It's actually not. So just explaining that and taking time to explain it to people who are on the fence, we will have about 10% of the people who will, no matter what, not make up their mind. But really people who are on the fence about vaccination, giving them the right information, giving them the time, answering their questions, I think really makes a big difference. And again, partnering with community ambassadors is most effective. Sometimes, you know, you always want a healthcare professional out there giving the message on vaccination. That doesn't always go well. So community ambassadors, identifying people who are influential, I think that goes a long way in the community.
Well, thank you. I know we have, I thought it was through IDPH, the ambassadors, that could, yeah. And they've been doing a great job in my area. So I'm in Southern Illinois, yeah.
We have over 1,200 people, you know, regular people, some moms, coaches, all people from all stripes, covering all the parts of the state, who push out that information and hopefully engage people in their communities, their own friends and family on these issues. So it's not like, oh, the government's telling me this. You know, someone's like, oh, so you, Ngozi, you really think that this is something I should do? I should get vaccinated, and then stimulate that conversation after they put things out on their social media. So I think it's been helpful. If anyone still wants to join and be a community ambassador, we're always taking more people.
Yes, please get engaged in this fight. So what are we doing across Illinois now to plan and prepare for the next pandemic, both to mitigate disparities and harm across race and income groups and to ensure the safety of healthcare workers?
I can start with some of the things that we're doing to look ahead and to plan better for, unfortunately, the next one, which we might still see within our lifetimes. One thing that an ability that we have that we did not have last year was really the ability to do genomic sequencing. That's a process where you're able to take a sample, in this case, a sample from someone who had COVID, and be able to do the testing to find out, what exactly is the makeup of this virus or this bacteria, and being able to tell for ourselves, is this the same one that's been around in our community, or has it changed and mutated into a variant? So we didn't have the ability to look for variants ourselves. We now have that ability. And so we are going to be able to use that, not just for COVID and detecting variants in that setting, but even when there's a food outbreak, and if multiple people are coming forward saying, oh, I got sick too, we can try to identify the sources of illnesses. So we're developing new capabilities, and COVID forced us to do this, but it will have broad-reaching abilities. We're expanding wastewater surveillance. I don't know if everyone knows what that is, but this is, instead of actually testing people and looking for a disease, you test the sewage water and still pick up, in this case, we're looking for COVID in the sewage. And so as you collect these samples week over week, you might be able to see, like, oh, there's an increase in the amount of COVID that we're seeing in the sample that came out of this community. That is a signal that something is peaking. And so the rise in the sewage water will actually come about a week or so before you actually have people getting sick. So it's a way for us to try to stay on top of things, get early recognition of some problems, and hopefully be able to intervene at earlier stages. So some important things that we've developed as a result of learnings from COVID.
I'll jump in next and just say that the investments from the federal government, I think, will be going a long way into fixing or starting to fix some systems that were very fragile to begin with. Healthcare is one animal, but I'm thinking about all of these other social support systems, like our housing system, our other systems that provide care to communities of color, communities that have borne the brunt of COVID, and give more resources that will not only hopefully repair the harm that's already been caused, but start to rebuild some of these systems in a way that make them more resilient. At the state level, I want to offer thanks to all of the members of the General Assembly who supported the legislation from earlier this year that authorizes community health workers. That was in the Black Caucus's Health and Human Services Pillar Bill. As we talk about community ambassadors and the role that community members can play in the healthcare world, being messengers as well as facilitating and navigating individuals through healthcare systems, that I think really lays some groundwork and builds on many of the organizations and individuals that have been engaged at the local level, vaccine ambassadors, and really start to think about how those individuals might be able to be integrated into not only a healthcare team, but really a public health framework.
I absolutely want to echo that. With the role of community health workers has just been tremendous. And on the flip side, from a global perspective, what's happening in one part of the world kind of predicts what you can expect. So surveillance systems are so important. Delta strain came to the UK months before we actually saw it here. Even now, the trends in UK are concerning with the new Lambda strain. We're still calling it a variant of interest, not a variant of concern, which means that the vaccines would still be effective against that. And so far, it's getting burnt out. It's not spreading like the Delta strain. But the surveillance systems are so important. Any clues that we can get, we need to be really vigilant. And that's one thing we've learned from the current pandemic. We do have the ability to do that. Johns Hopkins has a really nice website, New York Times COVID tracker, CDC. They're tracking the numbers so carefully. They're giving data up to the county levels. So surveillance, risk assessment, and funding, of course, to be able to research and continue to have strategies for future pandemics.
And thank you. And thank you, Kathy, for acknowledging the work from the Illinois Legislative Black Caucus and their healthcare pillar, and the important pieces that were put into the legislation to help move us forward as a state. Many of us in attendance tonight are policymakers across all levels of government in Illinois. What can policymakers do to support these initiatives? And that's open for any of you to jump in and provide a response for us.
We have had amazing support from our state legislator. I want to add my thanks for all the incredible work that's been done. In addition to having legislation that holds people's feet to the fire to get the work done, of course, what we also want to see are funded mandates to make sure that not only do we have the what we want to do, but how we're going to do it in terms of having the appropriate funding. And so we're always wanting those to go hand in hand to make sure that we can actually effectuate these great ideas as we identify ways to improve the situation for all.
And ditto to that. I would also say that I think this is implied in the comment around funding, but infrastructure, funding for programs is really important, but making sure that there are staff at the different government levels to actually oversee those programs is something that needs to be, recognized about the importance that the role that government plays, but people are in government, and you need both in order to have effective systems run and be efficient and really respond to needs.
And I would like to add my thanks as well. Thanks for listening. Really, that's so important. Thank you for listening to people at the grassroots levels, and thank you for the advocacy. So I think that's really gone a long way. And I cannot underestimate the importance of funding. So I would add that as well.
So what do you all think that what can public health professionals do to combat health inequities?
Well, there's a lot. I know everyone can jump in on this one, but the first thing is to identify it. And that means actually looking for it, studying it, collecting the data. I know from the state health department, we are the main repository for all kinds of data. And it is something that we have to continually improve on in terms of getting the data, but not just getting it, but making sure we publish it and get it out to people who need to see it, and in a timely fashion, right? So when we collect data and then we don't put a report out until 5 years later on something from 5 years ago, by the time people are reading that and saying, oh, we need to do this and this, the situation on the ground may have already changed. Mm-hmm. So we have to continue, and part of that is having the appropriate amount of staff within the health department to make sure that we can turn over this important data and get it shared and slice it in the ways that it's helpful to the communities to make important changes and pivots and create appropriate policy based on this. So I know that's something I'm holding our agency to the fire around that, because that's an important piece to start it all, is to make sure people know what the data shows and what the inequities are, so we can begin working through the solutions.
Thank you, Dr. Ezike, for those comments. I would just say that IT is a very important part of this data collection system. And we're realizing that more and more. We want to make sure we are collecting accurate data so we can act upon those. Things like hotspotting were so useful for us. We were able to identify with technologies such as hotspotting who's getting exposed to COVID, who is falling sick with COVID. And then tracking the hospital numbers would tell us who's sick enough to be admitted to the hospitals. And then death was being tracked closely as well from COVID. So technology definitely is very, very useful. And trying to share that and trying to keep it up to date and also accurate is very, very important in public health.
All right, thank you. So we know that racial, socioeconomic, and geographic disparities, we know about those. We've seen those during the COVID-19 pandemic, and they are reflective of wider disparities across most public health crises. One example of this is the astounding racial disparities in maternal health outcomes in Illinois. And so this is something that I've worked on hard in the state legislature, most recently to pass a new law that expands healthcare programs for high-risk pregnant and postpartum individuals. How, if at all, have you seen this legislation in action in recent months? And what more can we do to protect pregnant and postpartum women, particularly Black women in our state?
We want to continue to thank you for your leadership on these very important matters. We all know the deplorable stats about the ratio of mortality, maternal mortality for Black versus white women in the state, and it's even amplified more than what it is across the country. So we know that the healthcare programs identifying high-risk people and giving them specific, directed programs is helpful. We're also very grateful for the legislation that is extending Medicaid to pregnant people for 1 year after the end of a pregnancy, because we have seen that a significant proportion of the deaths, the maternal mortality deaths, didn't happen, before pregnancy or in the 6 weeks, but happened well after. And so maybe if there was continued care and that the care was not ceased after 6 weeks, then maybe there would have been interventions. Those problems would have been identified to prevent some of those deaths. So we know that it's a multi-pronged solution to a very deep-seated problem that is really not just about pregnant women, but it's more speaking to the situation of Black people in this country generally, based on the history that started this country. And so as we do things that address all the social determinants of health, make sure that children in Black communities have the kind of education that their white counterparts have in more affluent communities, that upstream intervention will lead to those Black children having a better chance to have higher paying jobs that include insurance, that concludes living in communities with better access to care, better access to healthy foods, to just be healthier at a baseline, so that as they move into pregnancy or any other condition, that they are in a better health status. So everything and is part of the solution. But we thank you for the part that you have played with regard to those healthcare programs, because we know that education is critical too, and health literacy is an issue that we need to continually work on as well.
Thank you.
Yeah, I want to offer my thanks as well, Representative, and also speak to another part of that piece of legislation around looking, not only the coverage piece, but thinking holistically about the postpartum care and using a team-based approach and thinking not just about the initial postpartum visits, but all of the services that might be necessary to help transition a person after they give birth into, those first few very chaotic weeks and months of taking care of a new baby. And so, all of those things are just so critical in recognizing that this is a major event and that, more support is necessary. And how do we target services to individuals who are high risk, but also recognize that the postpartum period is a really critical one to identify issues, and that continuity of care is very important.
Thank you.
Thank you, Representative, for all your work that you have done in this regard. COVID has just helped shine the light on healthcare disparities, which has been there for a long time. I just want to highlight the role of telehealth and telemedicine in the care of these patients. It's actually been a double-edged sword. For us, it's helped a lot. We take care of patients from Southern Illinois all the way sometimes into Missouri. People come from very far to come see us, and telehealth has really been a blessing. But sometimes it so happens that there are important findings, especially with pregnant women. It's not always possible to get everything when you're taking care of women and young children, to be able to offer all that on telemedicine. So to use that judiciously and to use that optimally, I think that would be another thing that we can focus on to be able to extend good care to this particular group.
Well, thank you. And again, thank you all for your work that you're doing to address this crisis that we're having in our state with regard to maternal health. So access to quality health care is vastly different across the state. What effects does this have on health outcomes in different parts of the state? What do you see are the biggest barriers to accessing health care?
I'm happy to start with this one. Access to healthcare is nearly impossible if you don't have insurance. And that is just the unfortunate reality that we have in the United States. Fortunately, we do live in a state that has taken the bold steps and the necessary to cover individuals who wouldn't otherwise have access to our Medicaid programs, including individuals who are undocumented, as well as individuals, especially children of slightly higher income levels than in other states. And I think that I'm just so proud to live in a state where we do value healthcare as a right, and we are moving towards having more people covered. So I think that is a major barrier. And even if you have access to Medicaid or private insurance, keeping that coverage might not be as easy as perhaps some of us are fortunate enough to keep that coverage for Medicaid prior to the pandemic. There is an annual process that you have to follow where you file paperwork and you have to prove that you're still eligible. And that can be really cumbersome for a lot of individuals. And prior to the pandemic, when that process was still going on, many people would lose coverage because they didn't get the mail or they didn't respond in the time frame, but they were still technically eligible. And in fact, they just didn't complete the paperwork in time. So I think that that access to care, the first one is, do you have insurance? And and that is a huge barrier. I could probably talk about a number of other barriers, but I think my fellow panelists probably have other things to add here as well.
No, I think Ms. Chan spoke very eloquently about the difficulties for those who don't have insurance in this big diverse state that we have with, urban, suburban, and rural. We often have in many parts of our state, which are largely rural, that where we don't actually have providers, where we don't have specialists in these areas. And so even if those people happen to have insurance, actually finding those specialists for those special needs is a challenge. I know telehealth, it has a role there. And one thing that we are doing at the state is, we have a program to help fund, help with loan repayment if we can encourage people to work in these rural, more underserved areas. Supporting that decision to go to a rural area by helping with loan repayment is one way that we can direct these physicians to areas of great need.
From my standpoint as a specialist, I'll add a few things. I take care of pretty specialized population, patients with HIV, persons with intravenous drug use, also known as PWIDs. So some of those special populations, I think the health literacy level and the care that's culturally and linguistically effective is very important. A lot of times people don't want to seek care because of the type of diagnosis they have. So it's very important to be compassionate and also ensure that you're protecting them in every way that they want to be taken care of. And I would also say that sometimes, like Dr. Ezike was mentioning, the lack of specialists in certain areas, telemedicine has definitely helped out a lot. But again, that comes with a lot of issues with insurance coverage. How are you going to get the medications? So I think it's just holistic. There are so many moving parts to this. Travel. Not everybody has a vehicle to get to their doctor's appointments, so that's another issue. For us, there are certain areas where the meat packaging factory, Beardstown, we have a lot of Latinx communities there. And want to be able to communicate with them. We don't have an interpreter available all the time. So it's very important to be able to communicate in a way that they understand diseases like TB, infections that come with immigration, that population also you specifically want to address.
Thank you. Governor Pritzker, who, by the way, has been doing a great, fantastic job in continuing to, again, move us forward during this pandemic in our state. But recently, he called gun violence a public health crisis. Why do you think it is considered such?
Yeah, of course, it's a significant public health crisis. When we talk about even the life expectancy differences between certain communities in our state, some of those wide differences are due to the number of young people whose lives are cut too short. So we have the gun violence, we've had the opioid epidemic, and now COVID. All of these things have really worked to shorten life expectancy. But the gun violence issue is not something that is only in Chicago. We know that gun violence is associated with many suicides. And so there's a big tie between gun violence and mental health situation. So between some of the urban violence, some of the rural mental health and associated suicides, associated with guns, and everything in between. We absolutely have a public health crisis that needs a multi-pronged solution. It ties in, unfortunately, to domestic violence as well. So it's a huge, far-reaching problem. I know, when we think of our country and the amount of mass shootings, like we lead the world in these mass shooting, these mass casualty shooting events. And so these are issues that have to be tackled head on. It's not an easy problem for sure. And there are many underlying causes. It's, again, not a one size fits all solution, but definitely needs not just public health, but all sectors of the community sitting at the table, working together to figure out some of the different solutions that might be able to address different parts of the problem.
And does anyone have anything else to add? Okay.
I think Dr. Ezike said it all.
All
I
right.
want to add that the definition of a public health crisis is that it just does not affect one area or geographically limited to one place. It's many places, and that's what we're seeing, and aptly defined as a public health crisis because of the extent of gun violence that we see everywhere. And mental health cannot, say enough about that. With the pandemic, anxiety, depression, mental health in itself has become a real big issue that we need to deal with. So adding that to the multi-layered approach to deal with this is very important.
And that kind of leads us to our next question, which deals with many think that when you think of violence, of gun violence, we think of Chicago. But how does the gun violence crisis, how is it affecting other communities across the state?
Yeah, I think we spoke a little bit about that in terms of the use of guns in relation to suicide attempts and suicide completions, its role in even domestic violence. I know if we think about the maternal mortality deaths that we had in the state, some of those deaths were related to violence surrounding issues around the pregnancy and intimate partner violence. So it's very far-reaching, the issues associated with gun violence, and again, very complicated issues, but need very concerted efforts to make sure that we try to get a handle on this and hopefully have some better outcomes.
And then we'll switch to another topic that has been in our news lately, with Illinois having more lead pipes than any other state in the nation. And recent state legislation requires full replacement of lead drinking water pipes. Black and Latinx residents in Illinois are twice as likely as whites to live in communities with the most lead service lines. So what can you share about the timeline on securing federal funding to address this need? And are there any precautionary steps that Illinois families should take due to the prevalence of lead pipes in our state?
Yeah, thank you for that question. We are actually approving the plans for Chicago and thinking about the lead pipes in that area first. I think the legislation goes into effect on the first of the year, and there is a statewide task force that is coming together based on that new state legislation. So we expect that statewide task force to share, wide-reaching recommendations, and we'll be looking forward to implementing some of those recommendations as we get them from that statewide task force.
And I understand that the infrastructure bill that passed and was signed into law earlier this week by President Biden includes a pretty significant amount of money for lead pipe replacement. I don't know exactly how much is expected in Illinois, but I would expect that would help with the expenses that would come with that, in addition to all of the other infrastructure pieces that are so, critically needed 10 years ago, right? So this is certainly something that, is one of those issues where if you don't address it now, the harm is seen later on, and it is something that is a very, very wise investment to pursue now. I think the phrase is an ounce of prevention is a pound of cure, or something along those lines, but the expense that what we need to invest now is really minimal compared to the expenses that as a society and as a state we will have to take on through the negative health outcomes of lead poisoned children.
And as you talk about how people can keep themselves, families can keep themselves safe if they're worried that they have lead pipes, part of the normal screening in pediatrics involves getting lead tested. So that's in addition to the shots and the weighing and the getting the head circumference, getting the blood test to check for lead levels is very important. And so those tests start early. I think the first one is, probably at the nine-month visit, and then you keep checking it. So if we make sure that we adhere to that and then follow up, it is a program that we have at IDPH to ensure that people follow up on those abnormal lead level. And actually in the recent, about 2 or 3 years ago, we lowered the level of detection for which we will intervene to make sure that we're not allowing these levels of lead to be like, oh, that's not too high, that's okay. So I think, lowered it from 10 to 5, and then that level triggers, really a full-scale investigation, someone coming into the home to look at, is it lead paint? Are there paint chips? What is it that might be causing it? Might lead us to the identifying of the lead pipes. So I think one very important step is to make sure that you comply with those blood tests, those lead level checks as a first step to ensuring that no one is showing signs of elevated lead in this young population, where it does affect brain development, muscle and bone development, learning, etc. Finding all of that is the way to make sure we keep our families as safe as possible.
All right, well, thank you. We have concluded with our questions for this evening. So I would like to ask each of you for any closing remarks that you have for our attendees this evening.
I can start. I just, first of all, thank you so much for having me. Thank you for this gathering. I learned a lot from my fellow panelists. And again, we have to highlight, Representative, all the great work that you're doing. I think the bottom line is that the health of our communities is everybody's business, and it's everybody's responsibility. And we all can come up with better solutions for attacking some of these challenges when we're all seated at the table, getting all the diverse voices and representations from everyone in the community present to make sure that our solutions are appropriate, culturally appropriate, linguistically appropriate, and will have the right messengers to share these important messages with our community. So if we are continuing to do that, as COVID has reminded us that's the way to do it. I think we can tackle these challenges that we started discussing here and the many others that also need attention as well.
I also want to offer my thanks to IWIL and thank you to you, Representative. You know, I think that if there's anything that we can take away as a silver lining from COVID is that we want to really think big about some of the solutions that we should be pursuing and can be pursuing and can achieve. You know, I'm so proud to live in a state again where we have lots of progressive policies and policies that are rooted in equity, that we have policymakers who are putting equity at the center of the work that they are doing. And so, you know, we should not let, after we are on the other side of COVID, we certainly don't want to lose sight of any of that because there's a lot of work to still be done. And I look forward to working with many of you on what comes next. So thank you again.
And I'd also like to offer my thanks to this wonderful group. Thank you so much for inviting me. And it's just such a pleasure to listen to Dr. Ezike and Ms. Chan. It's just been great. Thank you for the discussions. I just want to say that with COVID, we have seen a lot of collaboration. And moving forward, we just want to keep that momentum and keep that going. You know, identifying again disparities. This has shined the light on disparities which we knew existed. Taking that information and moving forward, keeping up the work that we have done is very, very important. Not to lose that momentum, I would say, is very, very important. And also, you know, internationally, nationally, statewide, different levels, the work that's being done, we can always learn from what's happening and apply that to where we are and what's relevant to us. Thank you again.
And thank all of you for agreeing to be a part of this panel. It was very informative, and I look forward to continuing the work. It's a lot of work yet that we need to do. So at this time, and thank you to all of the attendees this evening for tuning in and receiving this information. And now I would like to turn it over to our president, the Honorable Barbara Curry.
Thank you so much. And thank you, wonderful, wonderful panel. And we are really appreciative of your time and especially of your expertise. And I think that LaToya put the nail right in where it needed to be. All of us are appreciated too, because we've been listening and we've been learning, and we have a lot to share with the people that we work with and the people that we serve in the community. Again, a special recognition to our class of 2021, to our board members, to our alumni, and special thanks to our programming committee who put this whole forum together. Here we're in the middle of selecting our delegate class of 2022. There are going to be wonderful women, great leaders, and we're going to tell you all about them as soon as they're selected. But in the meantime, remember that these programs are offered to our classes at no major cost to the participants, no major cost. And this can happen only because of your very generous support. We're a small organization, our reach is huge. We did make it easy for you to contribute tonight. If you'll check the chat, you will find that we've provided a link so that you can send your money directly to IWIL Training Academy. Your help allows us to continue training Democratic women to run for office, and when they do, they win. So thank you all very much. Happy holidays and stay well.